rather than at 7:30 in the morning in a San Antonio hotel. Hopefully that is helping participation from those who are not early risers. What hasn't changed, however, is Trinity's commitment to bringing you speakers who are knowledgeable, notable, and newsworthy. And this year is no exception. Today's speaker is Dr. John Whyte, Chief Medical Officer for WebMD, a leading online source for trustworthy and timely health and medical news and information. Dr. Whyte is speaking today on the lessons from the coronavirus and the relationship between public health and business. Without question, the pandemic has impacted global business in ways that we are just beginning to comprehend. Our speaker today has some unique insights into the ways the business landscape has changed, in some ways, probably forever. Dr. Whyte is a board-certified practicing physician who has been communicating to the public as well as private sectors on health and policy issues for nearly 25 years. As someone who has been a regulator, a researcher, an educator, and media executive, Dr. Whyte brings a unique perspective, having spent time in government, academia, and the private sector. At WebMD, Dr. Whyte leads efforts to develop and expand strategic partnerships that create meaningful change around important and timely health issues. He is particularly interested in evaluating consumer trends in digital health and how innovations, especially in technology, change the way healthcare is delivered. Previously, Dr. Whyte served at the FDA as the Director of Professional Affairs and Stakeholder Engagement at the Center for Drugs Evaluation and Research. His office was a focal point for advocacy, enhanced two-way communication, and collaboration. In addition, he launched the Drug Trials Snapshot program designed to improve diverse representation and streamline the clinical trial process. Prior to FDA, Dr. Whyte worked for nearly a decade as a chief medical expert and vice president, health and medical education at Discovery Channel. This lecture will be moderated by Xochitl Hurtado, the chief operating officer at Methodist Healthcare Ministries of South Texas. She is a fellow of the American College of Healthcare Executives, and we are particularly proud to claim her as a graduate of Trinity's Healthcare Administration Master's Program. Dr. Whyte will speak for about 20 minutes, and then we'll open things up for your questions. You can submit questions using the comment section on Facebook or YouTube, or by emailing tigernetwork@trinity.edu. And now I will turn things over to Dr. Whyte.
Well, thank you, President Anderson. I'm delighted to be with all of you today. I'm glad it's during lunch hour. I hope you're all taking time to take care of yourself and to eat a healthy meal, to be active, to get up and walk after all the Zooms. Maybe not right now, but at the end. And I'm going to share my screen now. I do have a few slides, and I'm going to talk about, as President Anderson mentioned, what is this relationship between the business world and public health? Because typically we have thought of them as very separate and very different. But hopefully I'm going to convince you by the end of this lecture that they're very much related. And public health needs to be aware of the business world, and the business world needs to be aware of public health. As President Anderson has mentioned, at the Discovery Channel, where I've been, I'm at WebMD. I'm trying to control my slides. Let me see here. I'm at WebMD, where I've been for the last 2 years. And since March, we launched a show called Coronavirus in Context, where I've interviewed now over 150 experts. Dr. Fauci from NIH, Dr. Redfield from CDC, numerous health providers, clinicians, also pop icon like Tim Tebow, Ariana Huffington, Deepak Chopra. And there's some common themes that I've learned from interviewing all these people. And I want to talk about them over the next 20 minutes. But let's start off with, where are we in terms of this global pandemic? So in terms of the number of cases globally, we're at 33 million cases, a million deaths. In the United States, as many of you know, we're at over 7 million cases, over 200,000 deaths. And I included these two graphs, which I think are important to look at, because sometimes people will just plot the number of cases, the number of deaths, but it's important to see what the trends are and how many new cases are occurring every day. In the last 7 days, it's been about 300,000. This is just from a couple days ago, 45,000. Yesterday it was 30,000 new cases. In terms of the number of deaths, it's been about 200 to 300, which is much better than it was, at the height where it's over 1,000 people a day dying. So we're making some progress, but we're not exactly where we need to be. And it's always important to look at data. And there's lots of good sites online where you can look at your particular zip code and see what's happening in your area. And it's all about the local infection rate. And I encourage people to look at that. But when we talk about these numbers and when we talk about public health, we need to dig in deeper. And by that, I mean, let's look at the data and segment it by race and ethnicity. Now, as you may know, sometimes collecting that data, even on the part of health systems, we don't do as well as we should. And sometimes there's missing data. So it's not complete. But if we think about in terms of the number of cases, Hispanics typically represent about 16% of the total population, but they're representing over 29%, of new cases. African Americans are about 12% of the population, but representing over 18% of new cases. And when we look at the number of deaths and where they occur, it's not where we need to be. In terms of, Hispanics, 16% plus in terms of the number of deaths. Over 20% of deaths are in African Americans, despite 12% representation in population. And if you think about why is this the case? Well, we know that comorbidities puts one at greater risk. We know there's greater incidence of obesity, hypertension, diabetes in the African American community, as well as the Hispanic community. We know there's been challenges with testing in areas where minorities live. So when they do get tested, it's often much later in the course of the disease. We also know that typically they're employed in jobs that, are frontline responders, fire workers, policemen, the people that clean our institutions, the hospitals, the schools. So they're the ones that are at greater risk. And when we think about the issues of equity, these are the topics that we need to address. Why do we see these disparities in terms of death? It's not new to anyone that studies healthcare in terms of access and in terms of, ability to receive the best care when you need it. But, I wanted to include kind of this word salad about public health. And I have a master's of public health and I'm a physician by training. And when you think about it, what do people typically consider public health, right? They consider, the issue of drinking water. They consider, sexually transmitted infections, environmental hazards, air pollution, things that typically you don't think impact your daily life or impact you as a business. But public health is much more than that. It's also about the management of chronic disease, cardiovascular disease, diabetes. How do we help address that in the community? It's clearly infectious disease. How do we diagnose that? How do we surveil it? How do we test that? All the things that we need to be doing and should be doing to help, prevent the propagation, of this pandemic. And let's be honest, historically, sometimes it's, people are like, well, why do for me, a master's of public health instead of a master's of business administration? Because there really wasn't this recognition that these are very much connected. Public health and business, they impact each other. And when you think about it, look what has happened in terms of the pandemic. Public health really has impacted in many ways this economic crisis that we're having. And here's really the scope of it. Let's look at unemployment. Keep this in mind. So this is a graph from August 2019 to August 2020. COVID essentially wiped out 113 months of job growth. So the 14.7% unemployment, that's in April that you see. In August, it was 8.4%. In August of last year, it was 3.7%. And that's important to keep in mind, especially when we remember that insurance for most people, more than 70% of people are receiving insurance that's employer-based. So if you become unemployed, how does that impact your health? How does that impact the health of the community? But we always want to dig deeper. So as we look about unemployment by industry, right, this is what you would expect. We see a lot of unemployment in leisure and hospitality, in terms of air travel, hotels, cruises, including conferences. We're doing this virtually as opposed to in person. But also keep in mind, it's also industries such as milk processing, which has seen a tremendous decline. Schools aren't open. Kids aren't getting milk in the cafeteria. Restaurants aren't open. How is that impacting the tax base? How is that impacting, the community? So really anything that, required large gatherings of people have seen a decrease. Whereas what has shown increase? High tech, right? Amazon's. We're buying everything on Amazon. Some of you may be buying things on Amazon, as I'm talking. But that's where we've seen, an increase. We've actually seen an increase in housing, especially in established construction in terms of home sales of homes that have been out there, because people are fleeing to the suburbs. They're leaving the cities. And in some ways, healthcare insurance has grown because people aren't going to receive those services that they typically would need. We know that mammography is down, colonoscopies are down. People have delayed procedures. So there's really this impact on many businesses that are a direct result of an infectious disease pandemic. But as I've referenced, we always want to dig in a little deeper. So when we look about the impact of unemployment by ethnicity, and the blue box is those people that have been laid off their job. And the black box is those that have taken a pay cut. And we separate this by ethnicity: white, Black, and Hispanic. And what we see is that unemployment and pay cuts are primarily in minority populations. You can't see this on this chart. It's also in women. It's in lower paying jobs. It's in people that are less educated. And again, how does this impact health when most of us receive our insurance through employment? So how is that going to impact not just the health of individuals, but the health of the community? And in so doing, also the health of businesses. So I want to share this global impact, because remember, this is a pandemic. We talk a lot about what's happening in the United States, but this is all around the world. And this is the sharpest contraction of the global economy that we have seen in our lifetime. If you average it all out, it's globally a 3% decline in growth. That's huge. It's 3 times worse than the financial crisis in 2008. And I put a red arrow, whereas you can see that the decrease in GDP in the United States, over 9%. But I want to superimpose the next chart, which really helps explain the relationship between public health and business. Because the economic decline, looking at the second quarter versus the rate of confirmed deaths. So as you can see, the vertical axis shows the numbers of COVID-19 deaths per million as of August 30th. The horizontal axis shows the percentage decline of GDP relative to the same quarter in 2019. So let's take a look at what this graph is showing. I didn't add, all the countries in, because in many ways, the discussions have seemed to have been a trade-off, right? You either have public health strategies or you open up businesses. But there's not that trade-off. It's really about working together, and one supports the other. And this is what this graph shows you. Because if you look to see who has done well in terms of, minimizing the number of deaths and minimizing the loss of GDP, it's Taiwan, it's South Korea, it's Finland. And those that have done the worst in terms of big decrease in GDP, high number of cases, and you can see it here, is the UK and Spain, some of the highest COVID death rates, and the most severe economic downturn. And the point of this is that those countries that controlled the pandemic through public health strategies, testing, contact tracing, minimize the impact on the economy. The two of them are directly related. And South Korea and Taiwan were some of the biggest in terms of doing testing early on and in terms of tracing. Public health and business are directly related. So when do we return to normal? And how does public health help us do that? And there's a lot of talk about the vaccine. There's over 5 candidates currently, in phase 3 trials. There's been a lot of discussion about, will they be approved? And I wish we had this ability. If we were in person, I would ask people to raise their hand. We're not able to, but we'll virtually do that. And the question would be whether, if a vaccine becomes available this year, is that going to quickly change the situation in terms of a matter of months? And I'd ask how many people say yes or how many people say no. But here's what I'm going to tell you. Even if we do get a vaccine, and I hope we do, that's not going to change anything in the short term. Nothing's going to be different, really, over the next few months. Because any type of vaccine, first of all, is going to be available to first responders. Doctors, nurses, health professionals, policemen, firemen, and those people that are at greatest risk, people in nursing home, the elderly. Then we're going to move towards the broader patient population. All of this is going to take time. There's a lot of logistics to managing this. And let's be honest, there's a lot of concern by many people that it seems to be rushed and that they're going to decline taking the vaccine. And that's not going to help to reach that 60 to 70% that we want in the community to have some type of protection, what we're calling this herd immunity. And I'm going to tell you, I've worked at FDA for a long time. I don't think the vaccine is being rushed. I don't think we're explaining it well. I mean, it's kind of like baking. You can't cut down on the temperature, you can't cut down on the time, you can't cut down on the number of ingredients. Otherwise, you end up with a bad outcome. And that has happened to me when I've been rushed with my kids. But think about where the business world has helped in the public health world. We have had tremendous innovation. We've had nothing in January, right? Now we have had multiple tests that have gone through iterations, and now we're deploying more rapid tests. There's still some challenges, with accuracy and speed, but so much better than where we were even just a few months ago. We're using new technologies that previously took years that are now taking months. We're using new strategies for vaccination as well, something called messenger RNA, than some of the other type of strategies which we used in the past. Sadly, in a way, because there's so much virus around, we're able to get a lot of people enrolled in trials and see the impact. So we're actually doing well in terms of innovation and speed. And sometimes we're not explaining that, but we need to do that. But the business world really has stepped up to the plate in terms of innovation, in terms of the public health world. And the other thing that we think about, when we talk about Operation Warp Speed, and to be honest, as a communications person, I don't know if I would use that term, because in some ways, you're injecting something in your body. Do you want to say it's at warp speed? But having said that, it's also about therapeutics. Again, we had nothing several months ago. Now we're talking about monoclonal antibodies. We're talking about, the use of dexamethasone, a steroids. We're talking about, remdesivir. We're talking about a host of other therapies as well. And all of these strategies together, testing, therapeutics, treatments, vaccinations, that's what's going to allow us to return to normal, or to some sense of normal. It's not going to be any one of them, but all together. Working with the business world as well. Because if we want to reopen our communities, you need to control the spread first. They're integrally related. And that's been a challenge at times when we haven't thought that through. But if you think about it in terms of, this is a graphic that was created pre-COVID by the American Public Health Association about the traditional way that we think about prevention or public health, in business. And it's really around this idea that, if healthcare costs are high, you have a lot of chronic disease, in the community, much of which is preventable, that's going to be burdensome on businesses. It's going to increase healthcare costs. It's going to make it more challenging, to find the labor force that you need. And in many ways, for the business community, to help with population health is going to impact them as well. So it's about, having fewer food deserts where people can't get access to healthy foods. It's about, walkable paths. These are the things that we were traditionally thinking of. It's about, having clinics around, businesses so people don't have to take, a lot of time off to travel to get their health visits. But now we really have learned the impact of public health. And for me, it's really talking about there's not this trade-off between protecting public health and protecting the economy. You do both together, concomitantly, and not separately. So we've learned more than ever the importance of investing in public health, which we all know has not occurred in most cities. So when we think about, COVID, it's about the need for surveillance. How do we know that there is an infection in our community and to be able to address it quickly? How do we have adequate testing? How do we have innovation in testing? How do we do contact tracing? What's the role of technology in terms of doing that while still ensuring privacy? How do we have the business world participate in terms of what are the right strategies to reopen while keeping employees safe? How do we have the right messaging for the public in terms of, say, vaccine development, that we're not cutting corners? That's the role of public health that's going to help, in the business world. And when we think about the long-term implications of this infectious disease, pandemic, it's really going to be this idea of, how do we deal with this issue of urbanization? Are we going to see more people move into the suburbs? We're realistically going to see a decrease in business travel. So how will we address those relationships? Again, as someone who worked at FDA, how do we address the supply chain? In generic drugs, they're typically in one or two, areas of the world. But does that make sense now? Even though that might be cheaper from a security perspective and from an adequacy of a supply chain, we need to rethink that. And then in terms of healthcare, we're finally going to become patient-centric. And by that, I mean, we're going to bring healthcare to the patient. So, everyone's talking about telehealth and telemedicine, but it's much more than that. We're going to be talking about trackers and wearables hopefully none of you have fallen asleep while I've been talking. This is my contact information. I'm always happy, to answer questions directly. If you don't have time now to ask questions, happy to do it later. And at this point, I'm going to turn it over to Sochi and looking forward to hearing the questions. Sorry for that technical glitch.
Dr. Whyte, what a great presentation. Thank you so much. I know many of us watching are a bit on the data junkie side. And so in the spirit of fake news versus real news, really appreciate you putting up some really telling data that is really laying kind of a picture of where we were and where we're headed. In a lot of regards, I mean, that is very comforting to me. I also want to give you huge compliments on bringing something to light that I think, again, is really becoming a topic of awareness, which is the social determinants of health. Everything you were addressing about, poverty, education, how people are the environments they are growing up in or having to live in, and how that impacts their health overall. Given the pandemic, I know there's a lot of things that right now we would curse about it, but I will say there's a lot of things also that have really become a bit of a silver lining, and being able to recognize these things as very telling and data-driven facts is very important, as well as the difference between just telehealth and telemedicine, and how to go, more upstream versus downstream, which is just getting the access to care. So right on point with all the public health points. I loved your presentation. Thank you so much for taking what really is a complicated and complex topic of discussion and simplifying it very beautifully. So very well done. Thank you so much. So we do have a question that's been posted from Facebook, and Justin would like to know, and this is his question: given that many people likely will not accept the vaccine, obviously probably for different reasons, whether it be allergies, whatnot, we deal with it with the flu. When it does become available, in order to reach kind of that herd immunity, what are you estimating with your expertise for a back to normal once we do have a vaccination that's on hand?
Yeah, for herd immunity, which is really this sense of we get enough people immunized in the community, either because they got the infection or because they got the vaccine, you really need to be at 60%. And I'm going to be honest, my concern is, and we've done some surveys at WebMD and other people have done it as well, 50% of people say they're not going to take it. A large percentage of people say they're not going to take it in the first 3 months. And I get it. You have some concerns, so you're gonna be like, oh, hey, I'm not gonna take it. I'm gonna let Sochi take it, and then I'm gonna see how she does. Well, we all can't do that. So I think we need to have, a very effective awareness campaign and help people understand corners weren't cut. And, it's because of innovation that we're further along than we typically, are. And the other thing to remember from a business perspective is the reason why other vaccines have taken a long time is the government committed to purchasing the vaccine. So there was a business model for companies to invest in vaccination. So I'm realistically, for most community, it may not be till March or April until we get enough people immunized and get vaccine out there. It's not that easy. Many of these vaccines are going to require refrigeration or freezers. So that makes it hard to open up a big tent and just do it. Some might require 2. There's another one, not mentioning specific names, that may be 60% effective, is 1 dose, doesn't require refrigeration. That may help. But the reason I point this out is we have to figure out a strategy to stay sane while we stay safe. And the vaccine isn't the answer to everyone's hope. So, and I don't hear it as much anymore, but still a little bit, where we can't say, well, the schools aren't going to open until we have a vaccine. Businesses can't open until we're going to have a vaccine. That strategy is not going to work. And it goes back to the public health and business. So maybe it's more about the issues of therapeutics in terms of potential treatments for those who get sick. It's about the monoclonal antibodies. It's about the issues of better testing, how to protect the most vulnerable. But we have to figure out a much better strategy, of reopening, recognizing the relationship between the business world and the public health world. But it's not going to change overnight, and people have to recognize that. But we slowly have to continue to make improvements. And what I'm a big fan of, Sochi, as you talked about, is data. And let's look at data in terms of what's going on in your zip code, in your community, in your state, that's what matters. And I'll tell you, I'm on a task force about our school, and I've been talking about zip codes, and not joking, someone says to me, but we have to balance that by fear, the data. And I get it. People, are concerned, but we do need to look at data, and we do need to recognize there's no such thing as zero risk. And how are we going to balance competing interests? There's a lot of other impact of economic decline. And that's what I was trying to point out from the business world and the public health world. Unemployment, particularly in vulnerable and marginalized communities, is going to exacerbate chronic health conditions and is going to put more of a stress on an already stressed healthcare system.
Yes, what a fantastic point. And I think, again, I think that's getting lost, in the conversation. And I love a couple of things I noted in my head, quotes I'm going to have to borrow from you, is how to stay sane and safe. I think that's something, I know walking into my office today with the mask on, I thought, I look forward to the day when the announcement comes out that I don't have to wear this anymore.
We all do. We all. But
it's our new normal for now, and patient with that, because it's the right thing to do, most certainly. And I think it's also beautiful how you really continue to drive home that fact of the public health aspects and the unemployment, and how really the availability for testing and treatment and availability of vaccination, who can get it, is going to drive a lot of this timeline as well. And I think we forget that. And so again, thank you so much for bringing that point home. So we have a couple of the questions that have come in, again, from Facebook. So Justin from Facebook also would like to know, when you talk about herd immunity, right now there's some stories that are out there that talk about people getting reinfected, and viruses, the science is they kind of morph themselves. Yeah. That's why the flu is still around, right? And you have flu A and flu B. So we would anticipate COVID is going to be very similar. So can you maybe talk a little bit about that as far as the concept of herd immunity, and then the fact that there's reinfection we have to consider?
There's been a couple cases of reinfection, and we have very limited data. But here's what I would tell you from talking to all of these experts. Most experts do not believe that people get reinfected, that either testing was not accurate in terms of some of the testing may test for other coronavirus or may test for fragments, or some people may have a much longer course of the disease and they haven't truly recovered. Because if COVID-19 is like other coronaviruses, we do, like SARS, we do expect many months of protection. What we saw in some cases are people might have had a very moderate or minimal case of COVID, so they tested positive. They didn't develop any antibodies to that because it was so minimal. And then they actually got a much more severe case later. So I'm not, Justin, so concerned about, reinfection. I think we have some of what we're calling these long haulers. What I'm more concerned about, Justin, is in the fall, people getting flu because they either didn't take the flu shot or, they just don't practice, important public health measures, and then get COVID, which are totally different viruses. So you definitely can get both. And could you imagine, you get the flu, you feel like you were hit by a bus, right? And then you get COVID. That is a double whammy. That is a disaster, especially if you're immunocompromised. So, I'm recommending to all my patients that they get the flu shot, and I'm making progress on some of them. This is the year to get it. But I'm hopeful that we'll be like Australia, where they haven't had a serious flu season. And I think it's because people have been exhibiting these public health strategies.
Right. Yeah. And I think that's also, a big topic of discussion is the potential for that double whammy. And I know even us as an organization, we as well are stressing, if there's any 1 year to get the flu shot, it's this year. Don't neglect doing that. So thank you for acknowledging that.
And so I'm going to have a question for you when you're done with my questions. I'm going to ask you a question, if I may.
Okay. Yes. So I tell you what, we got Amy from Facebook, and she has, and this is a fantastic question, one that I was going to pose myself, just because it's important to me and the work we're doing here at Methodist Healthcare Ministries. So what can businesses do to strengthen the public health at local levels?
Part of it is, consistency of messaging. I think that's been a challenge for people. And I think businesses can go a long way in helping employees in that setting understand how you're keeping them safe. Like that's the first thing we have to address, that your safety is of utmost importance. And then I think we have to make it, easier for people in the community to get testing, to have surveillance, to talk about the importance of contact tracing. There's a bunch of apps that are out there, but the uptake has been less than 15%. People are just fearful, like, hey, I don't want you to know who I've been talking to or where I've been. I think there has to be a recognition of the business world that, as I've talked about, that public health is important and how do we invest in it? It's not just about clean water, and the air. It's about management of chronic diseases. And now's the time to address it. But it's worthwhile for businesses because you're going to have, a healthier workforce. You're going to have a decrease in your insurance costs. But in the short term, we have to get, employees to understand that their health is important to them, and that's top of mind, while also, helping support the community in terms of reopening and providing services, as the infection rate allows. And talking about data, that's what you and I talked about. There's a lot of data, and we should be looking at data and making decisions, based on data. Is kind of we were talking about up front about like what's the positivity rate? Like that's one measure. There's not one data point that's the end all and be all, but let's look at a bunch of things. It's not rocket science at the end. If you have an increased number of cases, an increased number of deaths, you need to implement some strategies.
Right. No, absolutely. And I could agree with you more. We're real big on messaging, getting the information out there, the awareness, just health literacy, the education portions of that, and creating access. So yeah, great question and great answer. So thank you for acknowledging that as well. So we've got Richard from YouTube. So again, we're across all the social media spectrums right now. Yes, this is fantastic. And Richard would like to know, could you be more specific on where you think changes are needed between the public health community and business? And he says maybe you can mention some of that during the slight internet connection issue that we had. So just again, the whole topic of public health and business and how do we come together to really make a difference.
Yeah, and what I was talking about then is, just being truthful and talking about how the worlds have been completely different. That, the business world has looked at public health as, it's about STDs and the water. And public health has looked at, just going to be honest, the business world, they're just about money and they don't care about anything else. Neither of those assessments are accurate and they're not fair. And part of it is, let's be honest, people don't network with each other. They don't understand each other's worlds. They don't know people in each other's worlds. So in some ways, it's first about, understanding the different worlds. What does public health do? And why is the business world so important for public health? It's also about, a tax base. It's also about providing jobs, providing insurance. But what more is there? And it's kind of like what I was going to ask you. I was going to play devil's advocate and say, in some areas, the business community, even health insurers have said, we have to address homelessness because hospitals shouldn't be used as, sometimes it's a homeless shelter, it's a social care network because there's not enough services out there. How do businesses help with food insecurity? And what I was talking about was food deserts. If there's not anything in your community to eat that's healthy, how do we expect people to be healthy? And that doesn't mean, offer things for free, but it can also be about how do we create tax incentives? How do we create, business partnerships to bring supermarkets into, certain areas? How to create walking paths? How to designate, a park? The business community can play a huge role in that. And then public health has to realize they're not in these little silos anymore over here that nobody knows, what they do. And I'm going to be honest, I've been involved in public health, and prior to now, I didn't deal that much, with the public health system, even as a provider, of healthcare here in, the DC, Virginia area. So I think it's going to be incremental over time to recognize this. But, if we want to do contact tracing and testing, we need the business community to help with that as well. We need the business community to help make it available, to employees, that the control of the pandemic is critically important for business as well. And they can't just think, well, the health community will take care of it, because it won't work.
I couldn't agree with you more. And I think that's a phenomenal tie as it relates to, again, back to that question of how do we partner in this? Because it really is a partnership. And, I know it sounds cliche, but the silver lining of this pandemic has been that we really have to come together, sectors, public health, business, civic, and together. And hopefully that'll really start a trend for many other things that we need to work on together.
Absolutely.
Okay, so I've got another question. Let's see, from Bruce from Facebook. And he would like to know, what is your theory on the long haulers? And that's quote unquote, does that data explain why some individuals are impacted long term?
And that is the phrase. That is the phrase that we've been using. And it's very timely, because what we're starting to learn is that COVID is not just an infectious disease. It actually has an impact on the neurologic system for some people, the cardiovascular system, the pulmonary system. In some ways, we're thinking it may have similarities to HIV, that it impacts more than just one system. And some people, especially those in terms of long haulers that have underlying health conditions, have experienced continued symptoms for some time. So it's real. It's something that we need to continue to study, help support these individuals. And that's why it's so important to control the virus. And a lot of young people think, well, it's just like flu. It's not just like flu. And that's the challenge. People with flu don't have symptoms 3-4 months later. That's not how influenza works. But some people getting COVID-19, they are subject to that impact. So it's real. It's something we need to address. And it's acknowledging that's why we want to catch it early on, ideally prevent it. But then if people do get infected, to catch early on. And that's why we're encouraging testing and then contact tracing. But it's definitely
right. I'm sorry. Yeah. So, I will be very transparent. I was probably in that camp early on as we were trying to figure out what is this thing. And all that we had at the time was, oh, it's flu symptoms, right? So false perception of, oh, it's just the flu and we've all had the flu, why are we panicked? But is obviously 6 months later and just the deaths that we've seen and the data and what it's told us and, the impact that it's had on individuals and their bodies and the long-term impact really has become eye-awakening. As I really, to my friends and family and all those people who are obviously getting the, quarantine fatigue and really wanting to start to let down that guard, I tell them, guys, we can't do that quite yet. Right. Very cautious and be careful because this isn't over. It's, I humbly admit I was in that camp of thinking it was just the flu very early on. So glad I know.
Yeah, but we also have to acknowledge that it's called the novel coronavirus because it's new and we didn't know a lot. And sometimes people are criticized, well, you didn't say that at the beginning. Well, you know what? We didn't know everything. And that's the point of leadership as well, that you modify recommendations based on new information. Like we all want to return to normal. The reality is, instead of new normal, I've been using next normal. Like what's the next normal? And in some ways, how do we moderate it? So how do we create a COVID bubble? So maybe we're not going to go out, to a concert, or, with 1,000 people, but maybe we can, work with other families and friends where it's 25 people, where we all kind of follow, these general, guidelines. So, we have to be, creative during these times, but not just, we have to recognize there's a mental health pandemic as well. And many people are struggling in terms of managing loneliness and managing uncertainty, and how do we help support them?
Yeah, great point. That's one thing. Again, public health, behavioral health, mental health in general was a stigma, and again, it was getting some traction before the pandemic to be really recognized, and not something that we should be ashamed of, but we should be putting our energy behind helping. And then, goodness gracious, we have the pandemic, and yeah, those individuals, I mean, they're starving for what was already missing. And this has only amplified that more. And we need to make sure we are cognizant. And I love that because I use that word myself, the bubble, how we create a very safe bubble so that we do have the social interaction. Part of I think that struggle with even the education system was knowing kids that's part of their learning and development is the social. So it was difficult for them to decide what was the right thing to do, even for their own bodies and minds.
But even another practical way that businesses can help with public health, even if we think about being very practical now, the holidays are coming up, Halloween is coming up. How does Halloween look different? Nobody wants to cancel Halloween, and we shouldn't cancel it. That's a time of fun, but how does it look different? Businesses can help in creating, and this is happening in some cities, a drive-through haunted house. So people don't, congregate in a haunted house and, breathing on each other. How do you create in your community? Maybe everyone will put at the end of their driveway or walkway, the candy in different, bags. There's ways to think about it that the business community can help as well. A parade still with social distancing, downtown. And it requires some creativity and some effort, but that's exactly what we need right now in terms of managing this.
Right. And I think that's one of the things my kids even asked, what do we do for Halloween? And I kind of paused for a second. And I said, well, I don't know. We'll figure it out. We'll get creative. Maybe we have our own family Halloween party and, cookies, who knows? So definitely interesting times. I'm going to borrow yet another quote. I love the next normal.
They're all yours. You can.
I appreciate that. But yeah, so I think it's just a matter of really learning as we go and adjusting to that and being innovative, which, we can manage that. I loved, at the very beginning, you talked about being resilient. I think it's a country that's something that we're really learning to do in real time. Is how to be resilient. So, well, it doesn't look like we have any other questions. And I'm going to we'll keep chatting for just another minute or two to see if anybody has anything else they want to submit. But again, fantastic information.
Well, thank you
so much for, providing us the data. I think it's thank you so much for highlighting, again, I think just some things that get lost in the factor, which is that the unemployment, the social determinants of health, the impact of health overall, how the public health sector and businesses can really come together. This was very informative, and I hope those that were able to join us and didn't have internet issues some really key talking points from this that are very valuable, whether it be the dinner table or friends and family to share your information. So very honored to be able to have this discussion.
Thank you.
It was incredible information, and thank you for highlighting just things that I think a lot of us needed to hear.
And I'm going to tell you, though, of my 150 interviews, I've never been disconnected. This was the first time. But luckily, I have basic skills to get back on. So I'm glad it worked out. So
yes, you did fantastic. Didn't even beat. Pause for a second, and you were right back where you started. So thank you so much. Again, I don't see any other questions. It looks like we're going to end slightly early, yes, but again, thank you very much, and we will make sure that your information gets out. It was an honor to meet you and have this conversation with you, and I'm looking forward to seeing and hearing from you again in the future.
Great. Well, I want to thank you, and I want to thank President Anderson for inviting me and helping to raise awareness of these important issues and these relationships that we typically don't talk about. And that's why I was so delighted to be part of this and to acknowledge that these are typically and historically such different disciplines, but they're now much more related than we ever thought. And we have to figure out what's the path forward. So thank you, Sochi, and thank you, Dr. Anderson, President Anderson.
Yes, thank you very much, Dr. Whyte, and Sochi Hurtado. Thank you for that wonderful job moderating the questions and the conversation. It's just a pleasure to have both of you with us. And I want to thank everyone who joined watching this issue of our policymaker lecture. We will continue to bring new innovations as we're trying to keep things relevant, thinking about the world that we live in. And as you think about all that this conversation shows, Trinity does strive to remain a force in motion as we work on making sure that all of the knowledge we have reaches you in a very timely way. Thank you very much. Have a good day. Bye-bye.